Samantha is an artist and a mother and thought she had a normal life until a mysterious disease changed everything.
It's hard when you look in the mirror and you don't see you. I was first diagnosed with Graves' disease in August of 2017. I always look like I'm surprised and my eyes look like they're popping out of my head. I first started noticing that there was problems with my health in July of 2017. My health was awful, my heart was failing, I had awful tremors throughout my entire body. I had a very large pronounced goiter, loss of strength in my extremities, and I had very pronounced painful eyes. It was about 6 months postpartum when my symptoms first started appearing. I initially thought that it was just because I was out of shape from being pregnant, and then as the symptoms progressed, they got more and more concerning. When I first went to see the doctor, he told me that I most likely had MS like my father, and sent me on my way with a prescription for a head MRI. I saw a second doctor and he said as soon as he saw me, he knew what was wrong, and he also told me that my heart was beginning to fail. If I had not gone to see the doctor when I did, he said within a few days my body would start shutting down, and there was a very good chance that I was not going to make it to my daughter's first birthday, which was 3 weeks away. The decision was made that my thyroid needed to be removed in order for me to get my health back and no longer be in jeopardy of losing my life. I have this beautiful, amazing daughter, and so dying was not an option. I got my thyroid removed in July of 2018, and almost immediately my symptoms started to subside. For the first time in years, everything is essentially back to normal except for my eyes. I feel bad because my daughter is missing out sometimes because of the side effects of what's going on with my eyes. I just want to be able to look in the mirror and finally see me and be able to give my daughter a normal life with her mom.
Thankfully, there was still some hope.
Today is surgery day. I'm finally here to have my eyes fixed with Dr. Douglas, and I'm so excited.
Really excited that Samantha is here today. We're going to move her eyes back into their normal position so that she doesn't have the bulging and pain that she's been afflicted with. We're doing both eyes at the same time and also recontouring her face. So we're going to go behind her eye and remove a little bit of fat and shave down some bone on both sides. All right, today is the big day. You ready for this?
Yeah, as ready as I'm ever gonna be.
All right, well, we're gonna do it. So the first step is just kind of starting to peel away and get underneath all of our tissue. Now what we're gonna do is we're gonna go down onto the mid-face area, which we're gonna end up lifting off and really supporting and giving her a mid-face lift at the same time. And what we're doing now is just ablating one of the little tiny sensory nerves. She'll no longer have pain from this disease. So we're just taking this precision drill and just shaving away a little bit of the bone. That's the bone on the inside of the eye that we're removing. So we've taken the bone the whole way down and removed it. Her eyes are bulging forward, and we need to make more space behind her eyes. Now the only way to do that is to suck out some fat. So you can see how the fat wants to come out, and then I just kind of let it come out. And so now that that's gone, we can start to close up and turn our attention to the other side. So everything went according to plan, and I think she's going to be really thrilled with the result.
So let's take a quick look at what Samantha looked like before that surgery. And Samantha is joining us now along with board-certified oculoplastic surgeon, Dr. Raymond Douglas. Welcome, so good to have you. And how are you feeling? Are you happy with the results?
I'm back to 100%. I have no pain, I can drive, there's no light sensitivity, I can play with my daughter, I can draw again, so everything is good.
And you look great.
Wow. Thank you.
Needless to say, this is not a surgery you go get done at the local primary care doctor's office. So, Dr. Douglas, I must say I was pretty fascinated watching that surgery. Can you tell us a little bit more about how you accomplished this?
Yeah, the surgery itself is from the eyelid. We can actually go between your eye and the bone right there in that little space and kind of push the eye out of the way and lift up most of the face and kind of get behind the eyeball itself. And that's when I start to drill out some of the bone and suck out some of the fat. So it's like you have too much furniture in your crowded apartment, and you start to take out some furniture, which is the fat, or you kind of bust down some walls, and that's where we shave down some bone. But we really want to make some more room so that our eye comes back into place.
And Dr. Douglas, Samantha had Graves' disease, and this is one of the classical signs, symptoms of Graves' disease, is that bulging appearance to her eyelids. Can you explain why that happens with the Graves' disease?
Yeah, so Graves' disease is an autoimmune disease, and it appears to attack one of the receptors on the tissue surrounding the eyes. So it comes from the immune system, and the immune system and the bone marrow cells attack both the thyroid and the tissue around the eyes. And they really become separate diseases. So she had her thyroid treated, but her eyes still continued to progress and get bulgy. And so this is really just one of the things that happens with this thyroid eye disease, is that you have so much tissue behind your eyes and even accumulation in your cheeks that totally changes your face and appearance by this extra tissue.
So is anyone who has this aspect of Graves' disease with the bulging eyes, are they a candidate for this procedure, or how do you select the appropriate person?
Yeah, they are candidates. It really depends upon their symptoms. Many people can't go outdoors, they can't, drive a car, they can't be in sunlight. So in those cases, surgery really is incredibly helpful. And it runs the spectrum. It can be very, very severe or much more mild, where we just do a little surgery. So it can be quite variable.
What are you most looking forward to in the future?
Being able to do things with my daughter that I haven't been able to do the last 3 years because I couldn't go outside, I couldn't take her to the beach, I couldn't take her to the park because of the light sensitivity. Couldn't play in the snow because the reflection off the snow I couldn't see. So just everything I'm going to be able to do with her is going to be incredible.
And also just takeaway for anyone watching, if you just happen to be going about your daily life and you start to notice some changes in your eyes, get it checked out, because this isn't something that is necessarily, I'm assuming, obvious right at the very beginning. But I'm also so very happy now that we have options like this for people like Samantha, and you are living proof that there is hope. We're so happy for you, and Dr. Douglas, really impressed with your surgical skills.
Yeah.
Very well done.